Yeah. So the treatment, very briefly, there are some medications that we use for treatment, but first and foremost, the lifestyle medication is the most important. If your blood pressure is normal, less than 120/80, well, perhaps you don't need any treatment, but you should still do the lifestyle changes, okay? Now, if it is pre-hypertension, we know what is pre-hypertension. What is that? Between what?
120 and 140.
Yes, okay. Or the bottom number is between 80 and 90, okay? But even though we say it's pre-hypertension, it can still cause what? A lot of damage to your body over a long period of time, okay? So for people who have pre-hypertension, we strongly encourage lifestyle changes. You can do that, okay? Usually we don't treat them with medications, okay? But people who are obviously hypertension, we still want to start them with lifestyle changes. If it is not helping, then we start medication. There are so many different classes of medications, but the most important are what we call the thiazide. Okay, the thiazide is water pill. Everybody knows a water pill here. There are two different kinds of water pills. One we call the loop diuretics, like Lasix, okay? We're not talking about that. We're talking about the other group of water pills. We call the thiazide. Now, the most common thiazide diuretic that we use is called hydrochlorothiazide. Anybody has heard that long name? It's the most common that we use. But there's another thiazide which is even more important than the hydrochlorothiazide. We call it clothalidone. Okay, so if you're on a hydrochlorothiazide is not helping your blood pressure, you might want to suggest to your doctor to switch you on to clothalidone. It starts with a C, C-H-L-O, thiazide. Okay, why? Because the clothalidone has what we call a higher half-life. What we mean by the half-life is that we want to see how long the blood pressure pill stays in your system. Now, the clothalidone stays in your system for almost the whole day. The hydrochlorothiazide just stays in your system for just up to 8 hours. So it doesn't cover, even though we give it once a day, it doesn't cover you for the whole 24-hour period, okay? And the thiazides are very important for black people with high blood pressure because we are salt sensitive. We have salt overload. So even though we call it a water pill, what it's actually doing is that it's getting rid of the extra salt in our body. It will make you go to the bathroom very frequently, so some people don't really like it, especially the elderly people who already have prostate problems and weak bladder and all those things. But it's a very, very, very effective blood pressure pill. And then the others are called ACE inhibitors. The ACE inhibitors, like if you have diabetes, the ACE inhibitors are very good for your kidneys because they protect your kidneys, okay? Now, if you have something like a migraine with a high blood pressure, we want to give you what they call calcium channel blockers or beta blockers, because the calcium channel blockers or beta blockers treat both the migraine and then they treat your blood pressure. If you're an elderly person with prostate problem, we want to give you what we call the alpha blockers, because they treat your blood pressure and at the same time too, they treat your prostate problems. You understand what I'm saying? So we use the blood pressure medications for certain specific conditions, but generally these are the main classes of high blood pressure medications. A little bit complicated, but I just want to bring this to your attention. And be very careful to those with high blood pressure, the over-the-counter medication that we use, like what? The cold medications, they contain a substance we call pseudoephedrine or ephedrine, which can keep your blood pressure up, okay? So if you have high blood pressure, you want to avoid those cold medications. If you want to use them at all, perhaps you just want to use them for a few days, 2-3 days, no more than that. But I would even rather avoid them at all. Okay, so yeah, polypharmacy, too many different medications can affect the blood pressure also. So Yeah, so we talked about the complications already. Okay. Now, okay, I'll just show you some pictures. All right. Okay. So this is what the blood pressure does. Okay. You see the normal artery here. Okay. You see that?
Yes.
So it has a very nice smooth lining and everything. Now, with blood pressure, the inner lining, which I talked to you about, which we call the endothelium, starts ripping apart. So you start building up cholesterol particles. All right? And then with time, the cholesterol particles start what? Building up. You see that the pipe is now getting narrower and narrower. You see that here?
Yes.
So look at the